This is Dr. Naveen, physical therapist specialized in orthopedics. Previously, we discussed the topic primary cause of injury and associated pain with regard to musculoskeletal system and its prevention. As a part of series, this video is the last and third part. So in first video we have analyzed the overview of strength of the tissue versus stress applied over the tissue. Then in second video we discussed about various factors affecting the strength of the tissue, mainly physiological factors and mechanical factors, or there could be both factors which influence the normal strength of the tissue. So second part of the video we have discussed the important physiological factors which will affect the strength of the tissue, thereby the cause of the injury and associated pain. Now this is the last part, that is third part. Now here we will focus on some mechanical factors affecting the strength of the normal tissue, so that if you know how these mechanical factors are affecting, we can prevent the injury and their associated pain. Let's dive into the mechanical factors which influences the strength of the tissue. Here in this series I have taken tissue as a knee joint. So I will take that knee joint as an example in explaining mechanical factors also. Let's come to this analysis. Here strength of the tissue, that is strength of the knee joint, if it is greater than or equal to stress applied over the tissue or knee joint. That is, I have given an example, like if my normal strength of the knee is 3 kilometers of walking on a particular surface with x duration and y speed, if that is greater than the stress applied over my knee joint, that is if I walk for 2 kilometers, then that is less than 3 kilometers, so there won't be any injury. Suppose if I walk for 3 kilometers, that is equal to the strength of the present knee joint, so that also won't result in injury and no pain. Then another possibility, like strength of the tissue less than the stress applied over the tissue. Let's say my strength of the knee joint is 3 kilometers of walking, but I walked for 5 or 10 kilometers, which is greater than the strength of my knee joint. That leads to injury. It can be micro or macro injuries, and that leads to pain and inflammation. So in this analysis, the important factor is we need to always see that our strength of the tissue, that is strength of the knee joint, should always be greater than the stress, either it is in the form of activity, sports, or in the form of exercises in the gym, should not exceed the present strength of the knee joint or the tissue, so that you will prevent injury. So having said that, then how you can strengthen, how you can lift weights, how you can play sports, how you can improve your strength. For that, so there are principles for principles of strengthening, principles of maintenance. So we will discuss about those things now. So principles of strengthening and maintenance are very important if you want to increase your present strength without injury. Let's first discuss the maintenance part. Maintenance of present strength. let's say your knee joint capacity is 3 kilometers of walking. If you don't use that 3 kilometers of walking or in the form of activity or exercises, that strength of walking for 3 kilometers will be decreased. For example, let's say you had a fracture and you immobilized your lower limb for 2 to 3 months, then there will be disuse weakness. Your muscle mass, that is girth, will be decreased around the knee joint and your strength decreases. Now if you calculate the strength, you cannot walk for 3 kilometers. Your present strength will decrease less than 3 kilometers, maybe 1 or 2 kilometers. So maintaining present strength is also very important, either in the form of exercise or activity. So now we will discuss about progressive strengthening. Let's say my present strength, I have already discussed, is my present strength of the knee is 3 kilometers of walking. Because of the personal demand or professional demand, if I need 10 kilometers of walking in my day-to-day activities, then how to strengthen? So for that we need to calculate the present strength, that is 1 repetition maximum. This 1 repetition maximum calculation is a vast subject that I will take in the subsequent videos. In this present video, I wanted to explain in layman term. I want to give some overview about the idea and principles of strengthening so that people can use in day-to-day life. So there are 2 important principles of progressive strengthening. 1, any activity or exercise, if it is done gradually, it will increase the strength. So in the same way, any activity which is done sudden, if you want to increase sudden repetition, sudden weights, then that will result in injury. Then how much gradual is the question? This can be understood if you know the tissue adaptation principle. So what is the tissue adaptation principle? So already it is researched that 50 to 70% of stress of present strength can be used for increasing the strength. Let me explain. My present strength is 3 kilometers. So I will take the 70% of my 3 kilometers will result in 2.1 kilometers. Then 2.1 kilometers of walking I will do for a week. Morning and evening I will do. After a week, when I assess my present strength, it becomes 4 kilometers. Then from that 4 kilometers, when I calculate 70% of 4 kilometers, it comes to 2.8 kilometers. Again now with 2.8 kilometers, I will walk for a week, that is second week. And after second week, I will again calculate the present strength, it will come to 5.5 kilometers. So like this, 50 to 70% of present strength over a period of 1 week, if I stress, I will get new present strength. That is, after a week, my present strength becomes 4 kilometers. After 2 weeks, it becomes 5.5 kilometers without any injury, because I am using the tissue adaptation principle. Okay, like this one can gradually strengthen and achieve whatever the target strength you required in your day-to-day life without injury. Now we will talk about specific strengthening. So patients, some people say I walk for 1 hour, I do regular yoga, but I still get pain. But they don't know the principle of specific strengthening. See, for example, computer professionals, they use neck more. Okay, drivers, they use back more. They sit for long time. Sometimes they may sit in bad posture. There are humps, jerks, that will give lot of stress to their back. Some people have, in their lifestyle, they will use knee joint more, like in the form of, some people have duplex, triplex houses. They need to climb stairs against gravity. While descending, they need to control the gravity. So there is a lot of stress in the knee. Some people have long standing, long walking. That also gives strain on the knee. So accordingly, first one need to understand, one need to assess their lifestyle. In that lifestyle, which joint they are stressing more. Proportionately, we need to strengthen, and always see that strength should be dominate over the stress. Now let's talk about the old people, like very old people who are above 70 years. They are unable to strengthen more as the young person does. Then in that case, that person can increase some amount of our strength, or they can decrease the stress. So that in that case also, they should see that strength should dominate over the stress. So hope these principles will guide you in understanding the primary cause of injury and associated pain, and its prevention of recurrence in your day-to-day activities. And one more thing I wanted to add. Patients, they come for, let's say, in our clinic, back pain, neck pain, they get treated, and they leave exercises after they become all right. But I advise that they should continue doing that particular part exercise, so that day by day strength becomes more. Sometimes knowingly or unknowingly our routine changes. We sometimes add more stress, sometimes we will be in bad postures, so that that particular part, soft tissue, will be strong enough to take that sudden stresses if you do regular exercises. So hope these all principles will help you in your day-to-day life. With that note, I will be signing off. I will see you in next video. Until then, bye and take care.